Mum Chat podcast. We're super excited to be back. It's been a while since we've recorded one of these. But in honour of Continence Week, we're really excited to be talking to Katie Richardson this evening about all things pelvic health and what we can do to help ourselves as pregnant and postpartum mums. So, Katie, thank you so much for joining us tonight. And I would just love to start with a bit of an introduction about you. So can you tell us a bit about your background and what led you to specialise in women's and pelvic health?
First of all, thanks a million for having me on. I'm always really keen to talk about this topic and spread a bit more knowledge about it around. So I am a physio and I also have a master's in nutrition. I'm a muscle mum of 3. And I really became passionate about this area from my own journey with endometriosis. It was back in 2012 when I was diagnosed with endometriosis. And I suddenly realized that there was very little support and information out there for women with any kind of women's health style issue. And so that led me into doing nutrition so I could really work on those lifestyle elements that women can bring in to help with their health and well-being. And then as I became pregnant myself and had my babies, I really started nerding out on all things women's health. And I had a few issues in my own pregnancies, pelvic girdle pain being one of them. And I worked with a physio in Ireland at the time, and it just made such a difference to my own pregnancy that I really wanted to learn more. So it was about 7 years ago. And since then, I have had 3 of my own babies, and I've also been a surrogate. So I've given birth 4 times. I've tried it all. I've had 2 vaginal deliveries. I've had an emergency C-section and an elective C-section. And so I feel like all that experience really helps with what I do now, and I've got pieces of knowledge to share.
Definitely shows as a client of yours myself. You definitely feel seen and spoken to and understood in all of those aspects. So it's really cool how much experience that you've got and how you're so willing to share it with us all, because it's being more and more spoken about and understood, but I still think that there's so much that people don't realise or maybe think they're alone. So definitely keen to help you spread that word too. So great to be talking more tonight.
In the last 3 years, there's certainly been a big change in what we're talking about. And even in the research, there's a lot more research going into women issues that affect us. But there's more to be done, and there's more for us to learn as health professionals, and there's more knowledge to gain. So it's really good just to keep talking about it and keep progressing, I guess. So the pelvic floor is a group of muscles. It's not just one muscle. It's a group of muscles that support your internal organs, your bladder, your uterus, and your bowel. And it's like a sling of muscles that holds everything up in kind of a hammock, really. And then when you're pregnant and during delivery, your pelvic floor has a lot of weight and change to it. So when you deliver a baby vaginally, your pelvic floor can stretch to 3 times its resting length. There's no other muscle in the body that stretches like that, and then is expected to function as it did previously. So it's a small enough group of muscles, and I think sometimes people think about the pelvic floor, they think about they end up engaging glutes and abdominal wall and everything. Like, it's a very small area, but it's got a very important job. It helps us to control and prevent any leaking. And by leaking, I think often we just talk about leaking urine, but it's also issues with fecal incontinence or urgency, or even gaps. When you're pregnant, it's hard to hold any gap in. That can be a sign of dysfunction in your pelvic floor, and women often experience that a lot more post-birth, but don't realize that it's a sign of pelvic floor dysfunction. So I think with all the changes that happen in birth, and we just can't expect it to function the way it did before. And so that's when we need to learn more about it and how to get back to that optimal strength and length post birth.
Yeah, see, that's, yeah, totally. And that was something, you don't really expect how intense that stretching, as you were sort of talking about, is. And absolutely, like after childbirth, you have this tiny little human to carry around, and you get back to your usual day-to-day jobs and things like that, and you don't really realize the sort of strain that has been placed on your body, and potentially not until you start experiencing symptoms, and then that's yeah, when you're like, oh,
very scary for women too. If nobody's kind of talked about issues like incontinence or issues with urgency of your bowels, and then suddenly you're holding your 4-week-old baby and you can't get to the toilet in time, you can just get a big fright and not know why. And the same with women who experience I'm sure we'll talk about later, prolapse, and that sort of heaviness and dragging sensation. All of a sudden it's a big shock. And I really feel like we should be educating our women whilst they're pregnant about this stuff so that they can address it and not have so much fear around it in that post-birth stage.
Like you say, like fear, but also that there are things that you can do and there's treatment available, and ways that you can get to your normal self. Because I think sometimes you sort of hear all the like jokes that everyone sort of makes, and then it kind of that where it's normal because it's so common, but it's also not normal to get back to your previous self.
Yeah. And I experience that a lot in clinic when people are like, oh no, I have no issues. And then I go through my 100 questions and you kind of slowly draw out that no, they can't jump in a trampoline or you can't do a star jump. And, that matters. And that's the kind of stuff that impacts how you interact with your children or how you return to sport. And, I think there was a study that sort of 80% of women have pelvic floor issues that prevent them from engaging in the sporting activities they want to do. That's huge. Yeah. Well, you need to come and see me.
I definitely do. Listening, I'm like, I really need to come and see you.
It's not far away.
Yeah.
No, it's a quick drive.
Yeah, and absolutely, like, well, the vulnerability is out there. Like as a mother myself, and as I said, I've been a client of yours, Katie, after I had my third baby, and it was like a bit more knowledge around it, able to seek some help, and we sort of found that for me it was later that I realized that I needed some more help with my pelvic floor because I hadn't had the desire to get back into some sports that I had been doing. And so there was not that realization of like, oh, I can't quite do the things that I used to comfortably, without, that sort of discomfort of having a bit of leakage. And I think it's so important to have it dealt with in one way or another. And that's where it's great to have the options available. So with your pregnancies or common stories that you hear in your practice, do you have any kind of things that you could highlight or share?
Yeah, absolutely. And there's always lots of kind of common themes that come up in clinic. But going back to what you're saying and pelvic floor dysfunction, like it's not just associated with the obvious things like leaking, but there's a lot of research going into the amount of pelvic dysfunction in women who have hip and back pain. So I will often, if someone comes to me with either of those things, I will be really trying to draw out of them if they have any issues with their pelvic floor, because addressing that can have a huge impact on both of those types of pain. But, the issues that I see are very common, and I appreciate you being so vulnerable and discussing that, Laura, because people just don't really talk about it. So it's sometimes people find coming to me quite confronting. I'm asking them all these in-depth questions, but we need to ask those questions, and we need to bring up these things. So, the role of a physio in pelvic floor isn't just Kegels and strength. And I think that's what people get confused. So actually more of what my day-to-day can be is dealing with women who have painful sex and painful intercourse after having babies. And as well as the usual can't jump on a trampoline, fecal incontinence and IBS and bowel issues as well after having babies too, and constipation, hemorrhoids, and they're all things we deal with too. C-section scars, making sure that your C-section scar is quite mobile, that you can use your abdominal wall properly, looking at those ab separations, and they are all linked into your pelvic floor and how you're using that whole part of your body. Like nothing works in isolation in the body, it's all in combination. And so we, having an assessment, having internal examination is really, really useful. And that then allows us to kind of delve into some more of those reasons as to why pelvic pain is occurring, or why you're leaking, all those kind of issues. Yeah, and disappointingly, a lot of totally, and then disappointingly, a lot of doctors don't really understand what we do either. So women will present to them with some of these issues, and they kind of get, given that just have a glass of wine and you'll be fine, or and unfortunately it still happens, and it happens all the time, and I've been in with our GP educating them on what we do and what our role is, because women are kind of getting left behind in these situations and just dealing with issues they don't have to just deal with. But it is certainly changing, and the ACC has really changed how this all works now. So ACC are covering maternal birth injuries from October 22, I think it is. And unfortunately for women before that, they can't avail of it, and that's just sort of a blanket rule. So, but at the same time, it's great that it's been introduced. But you can seek that care and get your subsidized treatments for anything from like a grade 1 tear to a prolapse, and that's really useful and really beneficial. Sometimes if people have coccyx injuries and tailbone injuries, that will be included too, but it's when they're making the regulation around it, it has to be really something that is caused from the trauma of delivery. So, but a lot of you don't really know as a woman, right, whether you have prolapse yourself. You really need to go to the physio to find that out. So I think it's worth for women prioritizing themselves and getting that initial assessment, and then finding out whether they can get on ACC or not.
Yeah. With that, like when a woman is going to come to say you or another women's health physio, what would they expect in their first sort of consult to find out what's going on?
Yeah, I find, so when my initial consult with patients is an hour long, and often that's a pretty heavy hour, right? Like we sit down and debrief your births and discuss everything that's happened, and that can be quite traumatic for women to, reach down and find those feelings about how it all went, and if it didn't go as planned, it can be quite hard. And then I will go through all my questions on bladder and bowel issues and past medical history. I'll get into intimacy and any issues that's happening there. Goal setting and figuring out what kind of exercise you'd like to do and how we can get you there. And there is always the option of doing an internal examination. You don't have to do an internal examination when you see a pelvic floor physio, but it is beneficial. So if you're happy enough to do it, it's worth it. But we can tell a lot externally as well. But I would always then sort of assess posture, assess the abdominal wall, any changes that are there, complete external or internal pelvic floor, and then be giving you sort of a home program of where we're going to from there. And yeah, but I think also often that feels like a very heavy and big appointment for people.
Absolutely.
So I'm on my first rodeo of a podcast, guys. Bear with me. No, but like in terms of causes of incontinence, so what do you find? Well, have you found? Were you recognizing what are the main causes of incontinence in women during and after pregnancy, and like why the issues are so prevalent?
So incontinence, like people will always kind of assume that incontinence occurs where you're weak, but that's not true. And often women who have a very tight pelvic floor can also suffer from incontinence. So, or people who experience a lot of pressure in that area, like women who do a lot of heavy lifting and CrossFit often present with these issues, or high level athletes as well. So it's not just pregnancy, but it is that change or pressure on the pelvic floor that can cause issues. And it can also be like, I often explain that it's kind of like your bicep. You need to be able to fully relax your bicep and straighten your arm, and you need to be able to fully flex and bring your arm all the way up. But for some of us with our pelvic floors, we're stuck halfway between the two. We never fully engage and we never fully relax. And then the pelvic floor can never fully react well to issues and weight within the pelvic floor, or jumping or exercises like that. And the weight of carrying a baby can impact that, but also things like trauma, women who have had sexual trauma or a lot of pelvic girdle pain, so a lot of endometriosis, women can present with those issues. So I guess what I'm saying is that although it's very prevalent with pregnancy, it's actually very prevalent in the female population anyway, for many different reasons. And the answer isn't just learning to strengthen your pelvic floor and doing Kegels. It's more complicated than that. And it's unique to everybody. Everybody who experiences issues will experience them for different reasons. But then going back to pregnancy, your estrogen in your tissues impacts the elasticity of your tissue. And we see that in our skin, and we see that in our musculoskeletal muscles. And so when you are pregnant and you have those changes, you're postpartum, and then especially if you continue to breastfeed, that change in estrogen can really alter how the muscle works. And so often for women, they might go through and have symptoms and issues postnatally, stop breastfeeding, they'll improve, but then they'll hit perimenopause and menopause, and the symptoms will become more prevalent again because that estrogen is dropping right back down. And so yeah, it's a complicated picture, and estrogen plays a big role in it.
Gosh, that's so interesting.
Am I correct in that for breastfeeding women particularly, that continues throughout the breastfeeding time frame as well, so it can sort of delay that true strength?
Yeah, and I do notice that clinically, and I notice a variance in women. Some women, still breastfeed and they don't really have that many issues, but there's some women that once they stop breastfeeding, there's a huge impact on their pelvic floor and their ability to contract and engage. Yeah. And then going back to that question of incontinence in pregnancy and post-birth, often women, not often, but sometimes women will tear internally in their muscles that are quite up high in their pelvis, and they're called levator ani avulsions, and they cannot be repaired at this stage. We don't repair them, but they do impact how well that kind of hammock supports. It's like someone taking off a few stitches off the front of your hammock, and it's starting to sag a little bit. So building up strength around that is really important to prevent any more symptoms.
Yeah, the sort of tailored programs and support for each individual's pelvic health is so important, right? Like you can find so much on the internet now, and programs and videos and things, but actually really quite key to get in and get something personalized for yourself and in terms of what you have going on, and get that actual diagnosis done.
Yeah. And I think, Laura, we've talked about this quite a bit, the idea of there being lots more technologies and different modalities coming out to support the pelvic floor. And some of them are great, and some of them do show that, you know, they may be really useful and beneficial, but they do need to be done with the guidance of a practitioner who can still assess your strength and figure out if that's what you need, you know. Like there's loads of, I'm sure you get them on your social media, just use this and follow the app and you'll have a strong pelvic floor. But if you're someone who already has a tight pelvic floor and then you're putting something in there and holding on to it all day, you're just going to make things worse. So you do really need to know where you are before you take on using any of those technologies and devices.
I think we sort of mentioned that we might have a chat about the platelet rich plasma as well, as being, it's not new because I feel like it's been around for 7 to 8, maybe even longer years, but it is still sort of not widely known about.
Yeah, I mean, it's still done, and it is used, but it's still being heavily researched as well, and it's used in lots of other kind of musculoskeletal injuries and that as well, and again, constantly being researched. But there are people who really benefit from it, and there are people who really benefit from using the chairs, the pelvic floor strengthening chairs, but they're not for everyone again. So like if you're choosing to do anything like that, I would always recommend seeing a practitioner who can do an internal examination first to make sure that's what you need.
I think for those things too, it's to realize that it's not a forever thing. It's almost like a band-aid to get you going, and then you do the work to get to benefit.
Right. Like it's like something to get you started, but you still have to do the exercises and you still have to work on your strength.
Yeah, absolutely. So maybe something to like get your confidence back so you can get into the things that you need to do comfortably to then have the long strength back.
Yeah.
Amazing. So some preventative measures that people can take either before the pregnant or planning pregnancy, and then during pregnancy, to try and help prevent these things if possible.
I would love every woman to get a pelvic floor assessment before and during pregnancy, and learning to engage and relax and actually learning to relax your pelvic floor is really important for the delivery stage. And we don't really push babies out. We just actually need to be able to relax our pelvic floors and let go to get the baby out. So learning to do those things is very empowering for childbirth, and I think then for that postnatal stage of feeling confident to begin pelvic exercises early or know that you're doing them right, like just so useful. And I hope that one day we do get to that point where every pregnant woman sees physio during their pregnancy. But learning to engage your pelvic floor properly is the most important thing to prevent this. Like, physio is the gold standard treatment of any pelvic floor issues and incontinence, and that is learning to activate properly. I don't think that people really understand exactly where the pelvic floor is, and I don't blame them because no one's taught them before. But it is very isolated, and if you are leaking during pregnancy, it's a real risk factor for having issues afterwards. So if you find yourself leaking, do go and get help during pregnancy so that postnatally you are less likely to have issues that will prevent you from exercising and doing things you want to do.
Right, so the strengthening can start before and after and during pregnancy to help what you're going to experience postnatally.
And knowing those kind of early signs that there are issues, like as I said, leaking urine, but also finding it hard to hold in your farts is a big sign that you're having issues. That heaviness or dragging sensations, things like going to the toilet and not getting a full empty of both the bladder or your bowel. And when you get up from the toilet, if you leak a little bit after that, that's another sign that you're not emptying properly, and there might be some pelvic floor dysfunction. So So if you're doing so a lot of women will leak when they like cough or sneeze, and people normalize that quite a lot, but that's not normal.
Yeah, it's sort of like the mum. Or I'm a mum now. I pee myself when I sneeze. It's kind of become the thing, right?
Yeah, totally. And
Just stop and cross and then
normalize it, and it doesn't have to be that way. And so, and again, a lot of women will say, "Oh, I have no issues," but then they won't jump on a trampoline. So, you should be able to jump on a trampoline. You should be able to hop on with your kids and not fear that. And so those are real symptoms. One of the things we haven't really talked about is prolapse, and that's where that change in the length of the pelvic floor during birth can reduce the supports in that area and cause either the bladder, the bowel, or the cervix to move down ever so slightly. And that really varies for different people. But for some of people, it's symptomatic. And if it's symptomatic, we call it a prolapse. But the symptoms of that are things like heaviness or dragging in the pelvic floor. And that will often worsen around the time when you're about to get your period. It'll feel quite heavy between your legs. Or it can be that you feel like visually it looks different, or there's a little bit of a bulge in that area. And that is something that you should see a physio about. Yeah, you don't need to go to a doctor if that's the issue. You can go straight to a physio and get it assessed. And if you do have prolapse, it varies a lot for women, and we grade it and stage it differently. But some women really do want to get on top of it and do need to improve their symptoms before they start to hit things like perimenopause and menopause, where symptoms have become a lot more significant.
So for someone like me who had a fairly traumatic first birth and then problems through my second pregnancy, which caused a lot of incontinence issues throughout my second pregnancy, I'm now nearly 11 years post. Is it too late for someone like me? I feel like I've so much significantly better than when I had just had my children. But still, like you say, I still do the stop and cross when I sneeze, and I don't jump on a trampoline, and I don't do star jumps. But I'm sitting here thinking, gosh, it's been 11 years. Like, have I left it too long?
No. Once you're postpartum, you're always postpartum, right? Like you can always get that help. We can always begin strengthening and see a difference. And usually within 6 to 12 weeks, we notice quite a significant difference to symptoms. So absolutely not. If you are experiencing issues, it's never too late. It's always good to go and start addressing them. And
that's fantastic.
Yeah, and with rehabbing your pelvic floor, it's not just some often people will be like, oh, I don't really need to go to physio, I do Kegels anyway, but it's not just doing 3 by 10 sets of engaging. If you're working with a physio, you will start with doing your exercises, probably lying down, and then progress them, and then move to doing them within exercise, like practicing jumping on boxes and practicing skip rope and that kind of stuff. And so there's a lot we can do, and you can do that at any stage, even if you haven't had it.
That's
Yeah,
well, I guess that's true. I guess there's people who haven't had children and
have all these issues. It's very common in women post hysterectomy. And again, as I said, people who do a lot of heavy lifting or elite athletes often have issues. So yeah, it's for everybody and at any stage.
When it's tailored to your problem, and if you stick to what you've sort of been given in terms of because it's like birth rehab.
And that's exactly what it is, birth rehab, and if you're doing your exercises really well, your pelvic floor will feel tired. I mean, and that's the goal. It's like strengthening any muscle in the body, right? You don't go to the gym and do 60 bicep curls and think you're going to, make progress. You need to be doing sort of 6 to 8 bicep curls and fatiguing. And it's the same with the pelvic floor. We need to be challenging it more than just 3 sets of 10. We need to be progressing and moving with the exercises until you are getting to that stage where you're doing your sport, and within that you're doing your pelvic exercise and strength work.
Physical therapy, we've touched a little bit on the chair plasma. Are there any other effective treatment options available at the moment?
There are that can be used in combination, and different women find different things very useful. Some women use biofeedback and electrical stimulation, and that's often depends on why they're in that position of having their pelvic health and how weak it is. There are some specific devices that you insert and then they connect up to your phone. There's one that's particularly well researched that came out of, I think it's AUT. It's been done by the physios in Auckland, and that has some great research behind it. It's the Juno FemFit. And you can actually see on your screen what parts of the pelvic floor you're engaging and how long you're engaging it for. And that's really useful for some women. But again, it's something else you have to do, right? You know, like you buy the gadget and you're like, cool, I'm going to do this every day. And then, you know, it doesn't always happen that way. So that's not good.
You have to use it.
Yeah.
Definitely.
It can be so beneficial to women, but it is something that you have to really, you know, be dedicated to doing. But you have to be dedicated to pelvic exercises as well. So.
And that can also be tricky in itself when you've got children, perhaps a career, and yeah, just those two things alone can make it really hard.
Is like is getting women to exercise, you know, getting new moms to be able to find the time and be able to prioritize themselves to actually do the exercises. And I don't really know the answer to that. You know, women are so busy at the moment, and it tends to be their own health and well-being that's at the bottom of the list. The only thing
we tend to put everyone else first, don't we?
Yeah, and you know, if it does impact the way you parent and your ability to run after your children and to lift your kids and all that, like, you do need to get it addressed. It's impacting your quality of life.
Completely agree with that. And it's something where you sort of see yourself now, but it's also the future. And if you can't, like keep up with the children, like you want to enjoy the games that they're playing, then it's absolutely something that we need to be making sure that we prioritize for our livelihoods, basically, to be, you know, lived out in the way that we want them to. And, you know, down the track as well, like if we become, a big one for me is like if I become a grandparent and I still want to, you know, if I'm physically fit and able to run around, I would love to be doing that without leaking urine. So it's a long game for sure. And I think it's such an important thing.
But, you know, there are simple things like if you're feeding your baby and you're lying down in bed, that's a great time to do your pelvic exercises. You know, in bed at night before you go to sleep. Like, you don't have to do them 3 times. And I think sometimes if someone says you've got to do them 3 times a day, it's too much, you just don't do any. You know, you're better to do a little bit at a time. And you're also better to do quality over quantity. You know, you're better to do 8 really well, 8 good reps, than try and fit in. So just doing a little bit now and then is helpful.
Like, if you see me driving around now, you'll be like, oh. But in the car, a perfect one for me, because I don't really listen to the radio and stuff too much, so I'm just sort of in my own world, and for some reason that's when it comes to be like, oh, have a squeeze.
If you're doing it really well, like, nobody can tell on the outside. You know? Like, you could be standing in your kitchen washing your dishes and doing pelvic exercises, and nobody can tell. You know, sometimes I see people kind of raising their eyebrows, doing some sort of funny thing. I'm going to do them, but you know, you're not. Your tummy's not moving, your bum's not moving. It's just purely.
And that's definitely somewhere where seeing yourself or another pelvic floor physio to check your exercises is great, because, you know, we had a session not long ago where you checked how I was doing my pelvic floor, and I was contracting too much in my stomach. So it's just so great to know, and then you can go away feeling like, now I feel how I should be, because it's a specific feeling.
And a really simple way
to
know if you're at home and you're wondering, am I doing it right? You know, your tummy should be totally relaxed, and when you engage, you shouldn't be drawing in around the belly button. Your bum should be really relaxed. Your inner thighs should be relaxed. And you're really focused on a really small area, like it's between the two sit bones on either side, and it's also between the tailbone and the clitoris. And I think that's a really kind of good way to think of it. Like, it's not a big engagement and a big movement, it's just a really small little lift. And if you put your hand on your perineum when you're doing your pelvic exercises, it should feel like it's lifting away from your fingers. If it's pressing down into your hands, you're doing something wrong.
Yeah. That's good tips. And with that, for Kegel is the pelvic lifts, right? And other than, well, how am I going to word this? But just like to share how to do this technique for people listening who maybe can't make it to a physio, or wanting to get started, but they can't maybe get an appointment for another 3 weeks or something like that. What's the best thing that they can do?
Again, I think, having that palpation, like having your hands on your tummy and your perineum, and seeing how they feel and what's happening, and making sure they're relaxed and lifting. But also, there's some cues that we use, and they're always like funny, people always laugh, but things like, what you're really doing is the idea of sucking up a tampon. It's that draw up, down in that area. Going, yep, throwing a blueberry up the and holding in a fart. It's very focused and very isolated. So there's some of the better cues that there are out there. I like to think of it as being like a jellyfish swimming. As you engage, it lifts up internally, and as you relax, it releases all the way back down. And that relaxation is just as important as that full engagement. So being able to fully lift or being able to fully relax.
Yes, in general day-to-day life, like when you're not doing these specific exercises, should we be in that really relaxed phase and then be able to like cue when needed?
That's what we call the knack. Like you should be relaxed, and then you're going to sneeze, and if you you have issues, you can suddenly engage before you cough or sneeze, and that will prevent you from leaking. And that's a technique you can learn. But yes, that's a good question, because when I started teaching Pilates, which was like a good 12 or 15 years ago now, we really focused on the engagement of the pelvic floor, and people would say, should I relax it? And you're like, no, you just have to engage. But now we know that was just totally wrong. That it'd be like walking around with your biceps engaged all day. So yes, to be relaxed throughout the day, and you shouldn't go for a run and just hold on to it the whole time. People often say that to me. They're like, I just run and hold on the whole time. I'm like, no, relax. So when you breathe, your diaphragm moves down into the abdominal space, and the pelvic floor should move down with it, and they should move together the whole time. And that's what they're really looking for. That's a really well working pelvic floor.
Touched on the next question about as busy mothers, it can be challenging to find time for self-care. How can busy mums incorporate pelvic floor into their daily routines?
This is just the absolute hardest. This is the biggest barrier to rehabilitation, is mums not having time. And I often find mums have time sort of 6-10 weeks postpartum, and then suddenly it all hits off, and then you don't see them again. My advice on that would be, at least go once and get an assessment and learn how to do your pelvic floor exercises. Then try and incorporate them in your day-to-day life. Like when you're lying down in bed, maybe you can start them then. And depending where you're at, I start most women in lying, but then I do progress into standing. So then I'm like, right, when you're doing the dishes, just give yourself a minute and engage your pelvic floor and do your exercise then. There are good apps and devices, as we've discussed, and some that does work for some women in terms of encouraging them to do it and making it a bit more doable. And then incorporating it into your exercise. Like if you are learning to engage your pelvic floor and then you're going to a Pilates class or you're at yoga, you can begin to work it within that and within those kind of functional exercises, and that can be really beneficial as well. But yeah, the big problem is, how do we get women back to exercise and help them to find the time?
It's the time and it's the mental load that we carry. And as Michaela mentioned earlier, you know, we put everyone else before ourselves, and then it's kind of, oh, I better do my thing, but it could be the end of the day and you're just exhausted.
And you know,
So
some women
it's
fall
presenting they're
into
having
bed.
really significant issues. You know, like they're you know, they might be leaking feces, they might be having bowel urgency and not making it to the toilet. Like that's really significant, and we need to allow women to prioritize themselves enough to address those issues so that it doesn't impact their body.
I imagine it would just be it would have such a hard impact on someone in terms of, like, you know, leaving the house, going out, social occasions, all those things.
Absolutely, yeah. Yeah. And women who have significant stress and incontinence. Yeah.
Sometimes still, and very much in the sort of early stages when I first saw you, good 3, nearly 4 years ago, using the Squeezy app was one that you had recommended. And with that one, is that easy to sort of jump on and put in a program, or is that something that, again, you would recommend having guidance on how many you should be doing, how often, and because it's quite a good one to just cue, and if you can put behind time frames, and you know, I used to just set them when I was due to be in the car or due for for breastfeeding, sitting there for ages anyway.
Scrolling anyway on your phone. So yeah, the Squeezy app is really good. It was developed by the physios in the NHS, and I really do recommend that. And that's worth, I think it costs about $5 to download, but it's worth the $5. The only thing I would say about that is often when women come to me initially, I don't start them on it because I'm like, okay, well, we need to just find your pelvic floor. You need to connect with this part of your body which you're so dissociated from. And, you know, that might be dissociation from trauma in birth or pelvic girdle pain in pregnancy or other traumas that's happened in life. And they just are, you know, it can be amazing how people feel about that part of their body, you know, and their associations with it. So often I'm just getting women to reconnect, and I might send them away for a couple of weeks, simply being like, I just want you to breathe and find your pelvic floor again, and then progress on to doing the Squeezy when I know that you're doing the exercises right, rather than sending you off doing them wrong. You know, so yes, I do think it's great, but I do think the internal examination really supports it.
Definitely.
Yeah. I mean, unfortunately, it's not like you could just go and do your exercises for 6 months and then right, that's it, you know. It's a constant life thing. It's, you know, and as we were talking about estrogen earlier, and as all those changes start kicking in, you know, you need to do your pelvic floor exercises regularly, and they need to kind of be part of your routine and part of your strength and conditioning. So long term, do your pelvic floor exercises. You know, it doesn't have to be every day or multiple times a day, but, you know, a couple of times a week, just checking in and making sure you're strengthening and being aware, like, oh gosh, I did leak at that stage. With a cough or a sneeze, maybe I need to do a bit more for a while. I think having a relationship with a pelvic floor physio is really good. Like having someone that you trust to have these conversations with, and you know, someone that you can go to in the future who can reassess your pelvic floor or have those discussions is really beneficial. And then also, you know, not just pregnancy and birth, but things like having really severe constipation, getting a really chronic cough or lots of vomiting can put a lot of downward pressure on the pelvic floor and worsen symptoms. And in general, if those things are happening to you, not being afraid to actually put your hands on your pelvic floor and physically support it when you're vomiting or, you know, is a really good tool. Having really good bowel health, because if you are constipated, it puts a lot of pressure on the pelvic floor. And so being aware of your bowels and not allowing yourself to get to that point is really important for the pelvic floor. And then, you know, with COVID, we have a lot more pelvic floor issues because of people coughing for a long time. So being aware that also those things throughout your life have that impact on pelvic health. Yeah. But in terms of resources, there is a lot of physios doing a lot of great things on social media. There's so many pages you can follow now. People sharing really good tips and knowledge. I would say that it's become quite trendy. There's a lot of people who maybe don't have the qualifications to discuss these kind of things are. So if you are following someone and taking tips online, to make sure that there's someone who is qualified to give that information out.
Such a good point, because there are lots of people out there in many fields who give a lot of information, but you do want to make sure it's good information to follow, for sure.
Right information.
The right stuff. You don't want to be going backwards, you know.
Bad advice.
Doing more damage.
And the World Continence Week that is this week, because we have across the Continence NZ organisation, and they've got a really great website with a lot of free support for people, from children right up to elderly people. So that's a really great one, and we'll pop the website in the show notes as well for
courses as
for
well.
that.
And I know a few personal trainers and Pilates instructors and stuff who have gone on those courses, which is very beneficial.
Awesome.
And that's again something, you know, when you go to the gym, if you're working with a trainer or something, they often don't know about this stuff, or it's awkward to talk about or discuss. And if you're, you know, in that, especially in that first year postpartum, you do need to be able to tell someone if you're leaking, you know, and that you can't do those squats or you can't do that jump box, because it's not going to benefit you, you know. Yeah, exactly. Yeah.
And if you seek the right, say, trainers, or Pilates, for example, is a great one where you kind of can maybe get to know the trainers in your area who have that ability to even let you know, like, right now, lift the pelvic floor during this exercise, you know, and then you can incorporate it into your, you know, exercise class if you manage to get along to one or two a week.
And
versus having to do them as your Kegels, like it's just part of your flow.
And anybody who's teaching prenatal and postnatal, you would really hope that they had that knowledge and that they would be educating women within those classes on pelvic floor health.
Awesome. Well, thank you so much, Katie, for coming along. Did you say yes, Nick?
No one needs to hear the horror stories of my peeing my pants in embarrassing places. That would be the only thing that I have to add, but we don't really need to get into that.
Sorry, I've got a little bit of a lag.
What were you saying?
I was just going to say, like, I think that's just part of it, right? Like, the more of us that say, hey, these are our experiences and people aren't alone, then the more people are going to come forward and actually be like, hey, me too. And I'm keen to get this sorted. So, you know, I think it's great that we can share these things, and it's not a shame thing. And if we can have a laugh, that's also great too.
I definitely have a laugh about it now. Yeah, it wasn't so funny at the time.
Not at the time,
Katie,
right?
Katie, I still do a little bit, but I used to dance a lot. Like, you know, musical theatre, and I was a dance teacher and all the things. And after I had my first son, he must have been about a year old, maybe not even quite a year, maybe about 9 months. And I went and auditioned for a show here in Hamilton. And you know, I was excited. First show back after having babies. I was still pretty fit, you know, young. I was 21, and I was ready to crack into it. I got through the dance audition. That was great. And they're like, right, we're going to do leaps from the corner. And so I was like, I've got this in the bag. And I just went full throttle into gallop from the corner into a big split leap. I landed that one, and then I was like, I'm going to finish it in the center. I did this big jump, and I split both my legs. And as I landed, I just peed. I just emptied out. Oh.
on.
Just in the middle of this audition on the stage in front of all these people, and I was just like, I gotta go, bye.
Out of here.
That was the first day that I realized that I really didn't have good control of my mind.
And then it's often not until you push yourself that you know that you have these issues, you know?
Yeah.
Absolutely.
Yeah, I think so.
Dancers
Yeah.
That was the day I learned that I could not hold it in.
Yeah. And then a lot of dancers get pelvic floor issues from that constant drawing up and especially ballerinas and that, the way they're taught to like hold everything up all the time. And then they just have these really
always very tight.
Tight pelvic floors. Yeah. And it impacts them a lot.
Yeah. Yes. Yeah. Massively. So.
Yeah. It's pretty amazing, and it's so great that we can start learning these things too, where perhaps, I don't know, ballet is quite a set sort of a dance style, but perhaps we can start learning from these things and the way that people train for certain things, like you're saying, like the CrossFit and the dancing and everything like that, and start just like altering how we're doing these things so that people don't have these problems later in life.
And it's not that women shouldn't lift heavy things. It's just that we need to teach them how to lift heavy things with a good technique. You know, I think that's the biggest thing. Like people, there's a lot of fear then, you know, and for a long time a pelvic health physio would have said, well, if you've got incontinence or pelvic floor issues, you shouldn't lift anything over 15 kgs. I mean, my daughter's 22 and I lift her every day. And so, you know, we need to be training our pelvic floor and our pelvic health function for the activities that we do in daily life and that we want to do.
Yeah,
it does. Yeah.
We just know how to do things.
Yes.
Right.
Yeah.
For sure. Any more stories, Michaela, before we end?
I mean, I've got so many. I have so many. We'll be here all night.
Oh, we'll book you in with Katie.
Started. We'll have you doing those jumps again.
Yeah. Doing split legs in no time.
Which is it?
My knees could handle it anymore.
Absolutely. So, and that's another great sort of just how we can sort of end is how people could find you, Katie, if they've resonated with you here on the podcast and want to come and get themselves on the track to having continence back in their life and get a bit of a program.
So on Instagram, I am Katie R Physio. And I work at the Physio Room in Raglan, so you'll find me there as well. I do online consults too, and that can be really helpful as well, just to start the conversation sort of going and help you find who you need to see or what might be right for you too. So the Physio Room Raglan is probably the best place to find me. My social media has gone a bit quiet over the last while with 3 children and trying to work and all those things. It's quite hard to do social media, but occasionally I'm good and I post something new. But yeah, you can always message me on social media as well.
That's perfect. Thank you. And we put
Katie.
Yes,
Physio.
KTR. We'll link some details in the caption and show notes as well anyway, so people can easily find you, and the Continence NZ website as well for any sort of resources and free support through there too. So thank you so much once again for coming on the podcast. It's so great to be back chatting and sharing this wealth of knowledge that you've got. We're very, very lucky to have you join